What's going on, everybody? I wanted to touch on something that has been coming up regularly in practice lately, and I guess before I go any further, for those of you who don't know me, I'm a full-time cradle-to-grave family physician here in Ontario, Canada. So by day, I'm seeing patients every day, all walks of life, from newborns to the elderly to patients in their 90s or in some cases 100, to antenatal care, postnatal care, and within that cradle-to-grave approach, I have integrated exercise, prescription, and lifestyle visits directly into my practice. And I'll make a video about that another time where I talk about exactly how I prescribe lifestyle and make it work in family medicine. But today I want to talk about being realistic about how much exercise can do for you and the limitations if we don't change our nutrition and the other parts of our lifestyle. Earlier this summer, I made a video about weight loss goals along those lines, where exercise, unfortunately, hasn't been shown to be a profound weight loss intervention for initial weight loss, and that for people who eventually lose weight, exercise seems to be more and more important for people who keep weight off. It's beneficial, it's the best drug known to man and woman, but for initial weight loss, tracking your calories and nutrition intake is very important and arguably more important than exercise. What I'm touching on today is growing muscle and preserving lean mass with age. And along those lines, although strength training, of course, is incredibly important to be strong and preserve your muscle with age, without proper diet and nutrition, you're certainly going to be missing out on some gains in preserving muscle with age. So again, I'll make a video about how I do this in practice, but in lifestyle visits, yes, I touch on specific exercise prescription. However, often I will see people who are strength training regularly, lifting weights 2 or 3 times per week, hitting every major muscle group 2 to 3 times per week, which the best evidence would say is ideal. However, they're not growing muscle, they're not changing. And when you question those other lifestyle factors, you find out that meals are being missed, or patients are not coming close to meeting their protein targets. And that's the other missing piece with preserving muscle with age as well. So similar to weight loss and exercise, although exercise is very important for preserving muscle and strength with age, of course, it's incredibly important. However, if somebody is really looking to optimize muscle preservation with age and the process of stimulating muscle protein synthesis, you're certainly at risk of losing out on gains with age, muscle gains, if you're not consuming adequate daily protein. And also if you're not consuming adequate daily calories. If somebody's only eating 700 to 800 calories a day, which of course is extreme and really low, but just to give you an extreme example, but consuming all those calories from protein, they're still in a significant caloric deficit, a huge caloric deficit. So it's going to make it difficult to optimize muscle gains and preserving over time. So if somebody with age is losing their appetite, for example, and they become what we call a tea and toaster, they have a slice of toast and tea with breakfast, and they have another slice of toast and a tea with lunch, which isn't a lot of calories at all, and is also very low in protein. Even if that person is very active, yes, they'll still preserve some muscle over time, of course, by being active and applying tension to their muscles. However, because of the low calorie diet and low protein diet on top of that, they're certainly at risk of chronic muscle loss and what we call sarcopenia over time, which is loss of muscle and also loss of muscle function. And I made a video about that on my YouTube channel. You can also watch that I posted a couple weeks ago. So as always, remember, exercise is an excellent drug, I like to call it, for both men and women. However, never forget that nutrition and all of the other factors in your life still play a significant role in how your body composition changes over time. So I hope you enjoyed the video. If you liked it, give it a thumbs up and be sure to subscribe so you can get notified every time I post a new video. We'll see you next time.